Good morning, everyone. My name is Dina Alchin, Senior Director of the Large Group Sales at Ward & Brown General Agency. We are excited for you to participate in a self-funded training opportunity with Kabuchi Banfield and David Wu, our new partners at Centivo. The training aims to equip participants with valuable insights into Centivo, who is an innovative health plan for self-funded employers founded on the belief that everyone deserves quality care at a price they can afford. Active listening and engagement is so important in being a valuable partner. Some simple housekeeping items. All cameras and microphones are disabled for this webinar. Should you have any questions, please use the Q&A box. If time permits, we will address during the meeting. If not, they will be addressed in a follow-up email. Thank you for our time together. Looking forward to a successful 2024 and beyond with Centivo.
And with that, I am happy to introduce myself to this wonderful group of folks. As you can see, I'm branding Word & Brown. My name is Kabuchi Banfield. I am based in San Diego, sunny San Diego, California. I have the opportunity to educate you on Centivo and how you can use us through Word & Brown to better support your clients to get more business, to secure the business you already have. And so we're really excited to help you help yourself and introduce you to something that you may not be familiar with today. I have started here with a slide of pictures that include events that I've done in helping educate members. So these are open enrollment events for clients who have selected Centivo, and it helps me demonstrate that this is just not a product that we're pushing. This is a relationship that we want to build with you in support of your clients. And so we are going to get in the trenches with you to help you demonstrate the value that we know we can deliver to each and every one of the employers that choose us. One thing I just want to emphasize, please do ask questions. We're going to do our best to make sure we get to those questions either throughout the presentation or at the end. Thank you for everyone who took the initiative to submit questions beforehand. That is always helpful so we know what is valuable to you. But let's jump right in so that we can make sure we use the time fully to cover content needed. So you have myself, Kabuchi Banfield here, as well as my partner in crime, David, who is going to help support in educating some of the educating on some of the Centivo tools. Specifically, I've asked David to join me to talk about the member mobile app. I think it would be helpful for you to get a sense of what that looks like towards the end of the presentation. But what the heck are we going to talk about today? So I tried to get a theme going, and I might have been going to the gym recently and everything says get fit. So I decided to have a theme of get. I want to get you motivated in the beginning. I'm going to articulate a little bit of what the Centivo value prop is, and then I'm going to get tactical. And this is where we'll likely spend most of our time. I want you to know what Centivo does, how we do it, and then I want to get going. I want you to know what it takes to actually get a quote and get things moving along to see if Centivo is a good fit for you to add to your toolkit. Ultimately, I want to bring home the money. So I want to get money and show you how we're delivering savings for employers and ultimately how we're going to help you grow your book of business. One thing that was in the invite that I thought I would want to bubble up in the presentation as well, ultimately, I want this to be a way for you to be a hero for your client. And the way that we do that is how do we make sure that we guarantee you savings so that your client feels like they're getting the best bang for their buck for your services? That's my mission to you, and I hope that that comes through in the presentation today. So I'm going to have a lot of info to talk about. After this slide, I'm going to have a little bit of fluff that I put in there just so you get a sense of how I might present Centivo to an employer. But before I do that, there are 4 things I want you to remember about what Centivo is and what we do. The first thing I absolutely want you to remember is that we guarantee savings in a fully insured equivalent environment. So we have said employers are too scared of the word self-funding. Is there an easier way for us to deliver a self-funded solution that feels, looks, tastes like fully insured? That's what we're delivering. So we're giving employers a way to earn money back at the end of the year while also guaranteeing them savings at the beginning of the year. The second thing I want you to remember, this is at the core of why Centivo exists. We have created our own proprietary network. When you think about the traditional insurance companies, they live and breathe off of their networks, right? They have provider contracts. Well, we have developed our own. We've gone out to providers in 13 states to build our own network from the ground up to compete with the traditional insurance plans. Now that network continues to grow, but this is our secret sauce. This is why people choose Centivo, and I'll get into that in a second. This is what we built alongside the ability to offer our broad network solution. We rent Cigna's network to offer alongside our own proprietary network as an option. So that's number three, delivering on that radical affordability. In our proprietary network, we believe in very core principles: no deductible, no coinsurance, and free primary care. It doesn't matter who our client is, no matter how large, how small, no deductible, no coinsurance, and free primary care. We offer this partnership plan, that's our proprietary network name, alongside what I mentioned, the Cigna Broad Network, and we will match those benefits to whatever plan designs that they have in place today. No disruption. Disruption is not a word we like to use, and it's not relevant to how Centivo delivers its offering to the market. Last but not least, the last thing I want you to remember about Centivo is we do everything. We are doing everything you expect from a traditional insurance company. So don't think of us as only providing a network. We're doing customer service. We've got the mobile app. We're doing open enrollment, everything, ID cards, everything you expect from a traditional insurance company, we are delivering because we are, in fact, a health plan. So those are the top four things I want you to remember. Now I'm going to get into the presentation to let you in on how I present Centivo and how I build it up. I thought it might be helpful to just talk a little bit about my own motivation as a backdrop to why Centivo exists. I started working in the insurance business in 2008. I was graduated from a school in Saratoga Springs, New York, small liberal arts school. And this is a picture of my 1.5-year-old daughter and my dad. And at the time when I was about to graduate, all I cared about was how do I make enough money to match what my dad brings at home? Because up until that point, I knew that if he could sustain managing myself and my siblings at his salary, how can I make the $33,000 that he was bringing home? Now he's a retired corrections officer from Rikers Island, but that was his take-home pay from Rikers Island. And that's all I knew. That was my definition of success. And I would have been content with that had I received it. I want you to think about that as everyone in society thinks about how they want to operate and what they consider to be successful. I want you to think about that as we also look at Kaiser Family Foundation study that says that it costs annually an individual $8,500 for individual coverage for insurance. Now that's a combination of employer and employee contribution, but $8,500 that could be going to that employee, and the term and take home pay is now dedicated and set aside for insurance. For a family, it's nearly $24,000 annually. So what do you do with someone who is willing to go into the market, understanding that they are going to make minimum wage, they're going to be lower income, middle income, but we're asking them to contribute a large portion of their paycheck towards insurance benefits? I'll give you another view of what that problem is and what Centivo is trying to solve. Relative to a percentage of their take-home pay, lower income and middle income families have to face a larger percentage towards health insurance benefits. This is a problem. And it's not to say that higher income folks are happy paying what they pay. That's not to suggest this at all. It's to suggest, how do we support people who don't have a choice around getting the quality care that they need, and being able to pay for it. That same Kaiser Family Foundation study, in addition to JAMA, released information suggesting that over time, we have forfeited over $125,000 in earnings by just submitting to the renewals from traditional insurance companies. You are not helpless. And my message today is to tell you that you have another option that you can work with your Word and Brown contact to learn and position for your client. This does not have to persist. And you can see I don't have my logo on this. I live in California, so I like to recycle. I saw this in a presentation and I thought I would bring it up again. This is just to give you a sense of, as you think about lower income families who have to pay a high portion of their take-home pay towards health insurance benefits, well, what does it look like for the businesses that we have traditionally relied on to deliver on affordable health care for our clients today? Well, if you're an investor, this looks great. You should be absolutely invested in one of these stocks. But if you knew that on the backs of the businesses, on the backs of your clients, that these companies were doing, they were outperforming the S&P 500 by a lot, how would that make you feel? What would you want to do to take action to support your client? That's all this represents. The Pablo Escobar is a little facetious, but I hope you understand the point that there's an opportunity to take control and not be subjected to companies who are likely taking advantage of you not knowing how to take control. So what do you do when you get those high renewals every year? The 20%, the 10%, the 8% that we think is amazing. What do you do when you get those renewals every single year and your client says, I cannot afford this. I need something else? Well, my suggestion is that stop looking at the status quo ideas, start thinking about something different that's going to change the paradigm that you have to face every single year. And call me a liar, but these are the 5 common ideas that I usually see. We're just going to shop it around to the top 4 insurance companies. One of them are going to want to buy the business. We're going to increase employee contribution or deductibles or copays. As an employer, sometimes they've got some money in the bank and they say, I cannot pass these costs to my employees. I'm going to eat it. And one of my favorites that I absolutely dislike, this idea of no bid renewal. Hey, if you don't show anyone else what is happening, I will come down a few points. It's absolutely ridiculous, and you have another option. Today, I'm recommending to you that you invite us to be a part of the discussion and just do the due diligence to see if Centivo could be a viable option for you and your client. We are committed to radical affordability. If there's anything you have to remember about what Centivo is trying to accomplish, it's radical affordability. We are unapologetic about making sure that people can afford their healthcare. And affordability applies to 2 stakeholders, both the employer, where most vendors, most insurance companies, right, we're going to make it cheaper for the employer. Yeah, but there's another stakeholder that's important, the employee, the member, the family member. We are committed to radical affordability for both. And I kind of teased it already with the no deductible, no co-insurance, and free primary care. But that's the point. How do we make it affordable for everyone? Now I'm going to shift into who is Centivo. Let's get tactical. Let's understand what we do, how we do it, and why we do it. I like to start by just sharing a list or view of our existing clients. These are companies across the country who have committed to affordability by hiring Centivo and putting us as an option in their plan offering. I hope this lends some credibility because if you may not have heard Centivo, I guarantee you that there are families across the country who are benefiting from the services we provide. And I want to bring that to you and bring that to your clients. No matter the size, no matter the industry, no matter the location, Centivo can and should be considered. So before I talk about the actual product that we've delivered, I want to just put something out there that may seem weird for me to say, but Centivo is not revolutionary. We are not doing something for the first time. It's not rocket science. In fact, if we looked at what jumbo employers are doing in the market on their own, independent of any vendor, they have realized that they have the size to say, hey, I can go into a specific geography where I have a lot of density of my employees living today, and I can go directly to the supplier of healthcare and say, hey, can I get a better deal than what you give to Anthem, than what you give to United or what you give to Aetna? And they are successful in brokering those deals directly with the hospital systems locally, and they are delivering better outcomes for their employees at a lower cost. This is an example in San Diego with Qualcomm and Scripps that did this in 2017. And guess what? It's still in existence today. They have that relationship directly with Scripps, and they still offer their broad network option with whoever their large broad network is today. Same thing that happens in Orange County. This is an example of Boeing saying, hey, I have a lot of employees that live in Long Beach and Orange County. How about we just partner with Memorial Care directly and not rely on traditional insurance companies? They are doing this and getting better outcomes at a lower cost. Centivo is taking that magic and making sure that it's scalable for clients of all sizes. This is not something that should be reserved for the largest employers in the country. What about the small businesses and the mid-sized businesses that need the savings more? Centivo is that bridge. You now have access to strategies that were used to only be reserved for jumbo employers. That's why it's not revolutionary, but we are committed to it in ways that traditional insurance will not commit to because they don't have to. So let's talk about Centivo. We've been around for a few years. We started out in 2017. We are a company based in Buffalo, New York, and New York City. We are delivering savings to employers across the country. I'm going to tell you just a few statistics that I hope sinks in. The first one is we are delivering 36% savings in total cost of care versus plans we have replaced. That's pretty significant, but I also always like to deliver that information in addition to telling you that we have increased primary care utilization by 34%. So this is not, we're saving you money by telling people that they shouldn't access care. That's not what we're doing. We're not deterring care at all. We also are able to deliver on that 36% savings while reducing members' out-of-pocket expenses by 71%. That goes back to that no deductible, no coinsurance, and free primary care. And I'm going to show you how we're able to deliver on all of this, but these are the statistics that help us create the value that is attracting these clients that you see below on the slide. No matter the size, we are here to serve you. We do have sweet spots, and I'll get to that as we get more tactical, but just understand Centivo has been around since 2017, and we're continuing to grow our book of business and deliver real value and real savings to our clients today. So what is it that we're actually offering? What is the product? We offer two products at the end of the day. Product number one is this traditional broad network solution. I alluded to it earlier. We are renting Cigna's network, and we are saying, hey, you like broad networks, you like the PPO, what I call the priciest provider network. Well, guess what? We've got access to it, and you can offer it in your own population. Nothing different, nothing unique, nothing special about that, other than we are meeting the employers where they are, no disruption. The secret sauce is product number two. This is our proprietary network that we built from the ground up to deliver alongside as an option at open enrollment for employees to choose. And this is where you get the savings. Both of those products are available to be offered side by side. If you only wanted to offer product number two, you can totally do so. we're not really interested in only offering product one, because why would we give you a cheeseburger without the secret sauce? That doesn't really vibe with why we started the company, but we would entertain it if needed. We have a few clients that have just done product number one, and I can tell you why. We started out only as a self-funded vendor. We said every employer needs to be self-funded. That's how they take control, get control back from traditional insurance companies. But we understand that there's a knowledge gap. It's a lot to it. And so we created level funding to make it super easy for everyone to have access to the self-funded benefits without having to have the extreme knowledge. Let alone we have the support of Word and Brown to help educate and navigate, but now we also have the cushion of our level funded solution to help deliver to employers without getting them confused. Across both product, we are doing everything. You never have to talk to Cigna. Everything that you expect from a traditional insurance company is being managed by Centivo. We're processing claims. You're getting your claims data, which you may not have access to today. Even if it's a 40 life group, 50 life group, you're getting your claims data. We are integrating with pharmacy benefits. So we standardly use Capital RX as our PBM. Remember that name. I'm not going to spend too much time on it today, but Capital RX is the PBM in our level funded solution. We have our mobile app that David will give you a sneak peek of at the end. And that's how you should think about Centivo, a full-fledged health plan, direct competitor to the Blues, to United, to Cigna, to Aetna. We are a direct competitor to all of them. So how do we typically deploy Centivo in a given employer? Well, I'll just say standardly, we have about 3 plans that are offered to an employer. And it might look something like this. Plan number 1 is our proprietary network, that product number 2 that I talked about. And then plans 2 and 3 are likely what they already had in place today, a traditional PPO plan, and then a high deductible health plan. You can switch it if you want. It doesn't matter to us, but this is just typically what you might see. What I had already mentioned earlier on when I said I wanted you to remember this is true for 100% of the clients that you saw on that slide. The partnership plan will always have no deductible, no co-insurance, and free primary care. Primary care all year long, not just preventive care. We want you to build a relationship with your PCP the same way that my daughter builds a relationship with her pediatrician, or I build a relationship with the pediatrician. But we want that relationship to exist because that is what's going to foster better outcomes at a lower cost. This plan is going to be very rich in benefit, but it will not be the most expensive plan. That's the Centivo magic. This plan is likely going to be the richest plan offered out of the entire suite, but it's likely going to be one of the lowest cost options offered. That's the Centivo magic. It's affordable both at the employee level and the employer level. If you looked at some of the things on that slide, it referenced that you do have to select a primary care physician. You do have to get referrals under that product number 2, the Centivo partnership plan. That's how we make sure we manage costs and control the experience. Well, that feels a lot like an HMO, but it is not legally an HMO. But it is better than an HMO. So usually, and I just learned this, so I'm excited to share, usually when you take an HMO in California, you have to stay within that medical group or you got to change your PCP. Not so much with us. You can go wherever you want in network without having to change your PCP. That is a huge benefit that I am going to start screaming from the mountaintops so that people understand that even though it feels like a big network that you're on, you're constrained just to your medical group unless you're willing to change it all. That feels inappropriate. We don't do that. Also, referrals are really easy for us. They're tracked on our mobile app. They last for 365 days. The intent is not to make it hard for you to get the service that you need. It's just to encourage you to build that relationship with your primary care physician. Oh, and did I say that it's no copay to go see your PCP? So even if you needed a referral, whether it's virtually, call on the phone, or go in person, you're not paying a dime to build that relationship with your PCP and get that referral. The broad network access is important. We want to make sure that employers, you feel comfortable about the network availability. So we do have that broad network access that you would absolutely get from Cigna directly. So there's no difference in the network option. Broad PPO, we have access to LocalPlus, and we have access to OAP. You have the Centivo experience behind it. ID cards, mobile app, customer service, all Centivo. You just have access to that broad network if needed. So let's get into the weeds of where Centivo's product number 2 is, that Centivo partnership plan. So we're not everywhere. Building a network from the ground up is very hard. So we want to do it in the right way. We got to make sure that we're delivering on the financial commitments of our product. And so it's not going to be everywhere automatically. But what I can tell you is based off of the coverage that we have today, we are covering a third of the American workforce because we're in these dense populated areas. What happens when you send information, an RFP, to your Word and Brown representative? They send it to me. I can immediately do a calculation of how many people on that census are within these geographies. Benchmark for us, we like to see at least 40% of the population just eligible for this network. They don't need to enroll. There's no minimum enrollment. And again, thank you for the questions in advance. I know that was one of them. There's no minimum enrollment for the Centivo partnership plan. We just know when an employee is offered a lower cost plan with better benefits, they are likely going to take it. And so we're prepared for whatever shakes out. But we just like to see at least 40% of the eligible population within this service area, because that's a good leading indicator that we can deliver on the financials that we commit to in the sales process. There's a little bit of marketing license on this slide. We are not in the full state of California. I can hear half of the group getting really excited when they saw the full shaded. Unfortunately, or fortunately, we are in Southern California only at this time. LA, Orange County, and San Diego is where our proprietary network relationships exist. I won't go through everywhere else in the country, but just know that is what our network looks like in California. Again, 40% is what we look for, and then anything above and beyond that would have access to the Cigna networks that we administer as well. So when we build a network from the ground up, there's going to be some disruption in that network relative to what they might have today, but we make sure it is adequate. We are following CMS guidelines on adequacy to make sure that when people need to access the care that they need to, that the doctor exists in the network today. In addition to that, we are building up our network with virtual resources because it's a new age, and COVID accelerated this in a way that allows us to feel comfortable in delivering these solutions. So we have a virtual primary care practice. I don't know if you've heard, Centivo acquired Eden Health recently. I'm not going to make the comparison that I usually do, but this is a full-fledged doctor's office that is served virtually. So this is not a you call in and you get a different person every time. You build a relationship with your primary care physician virtually, and that can be your relationship. And we have those doctors on staff if they want to go down that road. Other solutions are automatically built into the product to make sure people feel like this is super comprehensive. And so there are traditional insurance company networks that boast, we have 300,000 behavioral health providers in our network. I can tell you that they have 300,000 providers that you have a 6-month waiting list on. What's the value of that to an employee that needs the care right now? That's why these virtual solutions already built into our program makes sense and it's valuable for our clients today. I thought I'd just drill down a little bit to help you understand who our partners are within a geography. So if you recall what I talked about, what Qualcomm and Boeing are doing with their own business, we took the similar philosophy. Choose a provider, a high quality provider locally, and go deep with them. Traditional insurance companies aren't doing that. They've got HMOs, they've got ACOs, but they still have multiple competitors in that product. We are deciding we are going to choose a high quality, low cost provider in a given market and get a better rate than what those insurance companies can get and have better outcomes. In LA, that's UCLA and PIH. In Long Beach and Orange County, that's Memorial Care. In San Diego, that's Scripps and Rady's. These are our network providers that allows us to deliver on that affordable care for employees that need it and want it. I mentioned this, but this is an open enrollment decision. You have these plans side by side. They are looking at it at open enrollment and they will make the decision that's best for them. If someone has a child that studies in Arizona and they're enrolled in the plan, well, maybe this partnership plan is not the right fit for them. Maybe the Cigna plan is the right fit for them. And that's okay. That is a-okay. But we now give people a choice who want to look at a network that's affordable, a plan that's affordable, and they get to choose what's best for them without never having seen the option at all. So whatever the solution may be, if you like to go to Cedars-Sinai, if you like to go to Hoag, those are not in the Centivo partnership plan. The Cigna plan may be the better option for you, and that's okay. So let's get going. What does it look like to quote Centivo? I want to give you just a sense of where we see our ideal employers. We typically see most success with groups over 50. Not to say that we don't. I have 3 groups that are in the 20s and 30s right now that I'm quoting, but we typically have a sweet spot of around 50 to 300. That's where we see the most success, even with no data, right? Because you're not going to get data at that size in California. So whether you're fully insured today, whether you're self-funded today, it doesn't matter. We want to look at it. Industries that gravitate towards us. I hope you see a theme in this: manufacturing, nonprofit, retail, restaurants, education, hospitality. They tend to have a larger population of those lower paid workforces. These are employers who want to find a solution that is more affordable. And just to let you know who we typically don't have success with, law firms. Don't know why, but you can't tell them where to go. But law firms we tend to struggle with, and so we're not necessarily looking at quoting law firms. Not DTQing them, but just wanted to give you that heads up. Family-owned businesses, employee-owned businesses, they're paternalistic. They love solutions that are affordable and focus on making sure employees are well taken care of, so they gravitate towards Centivo. I mentioned the 40% benchmark. We want to make sure that there's at least enough people that can access the network so that we can deliver on our savings. There was a question that came through about can we quote an existing Cigna group? This is a very good question. That is the only limitation that we have. We cannot quote Cigna's network against Cigna business. However, if the group is not with Cigna Direct, if they're with a TPA and they just have the Cigna network, fair game, we can quote it. Number 2, we can always quote our proprietary network, no matter what. It's our network, we can do it. So just always know our network is always going to be available to quote. It may not be a good fit because it gets complicated if you have Cigna in there and then you want to quote our network. You can think of us as like Kaiser in that sense, where you just want to offer our product number 2 alongside a program that's currently in place. It doesn't really work unless the group is a little bit larger in size. So I typically say 500 or more employees. That's when we can start having that discussion. If they're below that, if it's a Cigna direct group, it's likely not going to work, but that's a conversation we can have, especially with the Word and Brown team. So what does that process look like? Well, typically, and of course I'm going to say it this way because I want to have these conversations early. I want to identify who's a good fit. Who do we think is going to actually enjoy working with UCLA, PIH, and Memorial Care and Scripps? These are direct relationships. They can have direct contact with these hospital systems in ways that they've never had before. Who's going to like that? Who is looking for savings this year? Who's getting that 20% renewal and needs something different? So that can tend to happen 5 to 6 months in advance. And yes, I'm being optimistic. I know that's not how it works, but I got to be idealistic. Um, I can start to do an analysis of network, right? If you just send me a list of zip codes, I can tell you, do we reach the 40% or not? Because that can tell us whether or not we want to spend any more time working on it. I highly recommend that you have us be a part of a meeting with the group. And trust me, I'm not a pushy salesperson. I can play my role. The idea here is how do we make sure that they understand what Centivo is? It's unique. And so we want to make sure they understand it before we spend so much time spinning our wheels only to find out they're like, what the heck is this? Get it away. So a meeting is preferred, not required, but we love it. And you can trust that I will show well in a meeting for you. Then we get into that proposal process. I'm going to talk about what I need to quote, but that proposal process takes 1 to 2 weeks. And so we want to make sure that we submit comprehensive data so that we can get this going and get it to you ASAP. Ideally, I want to have 2 months before the effective date to have a decision locked in. I know that's ideal. We can go to 30 days, but we just want to make sure that we're doing the right thing immediately. We don't want this to be a new relationship and things are clunky. So we like to have the time if we can get it. I understand that's not how it always works, but I got to ask for it. So what do we need to actually quote Centivo? Because there's typically no claims data available, we will need a member level census. That's a census that includes dependents, and that allows us to understand exactly who we are insuring. And I'll just be fully transparent. There's some creepy stuff going on where they're looking at publicly available information on prescription drug utilization. And so it allows us to measure the risk. And so that allows us to be able to provide a quote. And that's just the reality of insurance. We do need historical claims, historical rate information. So renewals, this renewal and the last renewal is going to be helpful so we understand the trend. Current rates, renewal rates for sure, plan designs, employer contribution, and if there's any HSA contribution. If claims information is available, we will want it and we will need it. It is always helpful in just making sure we're even more accurate than we typically are. But just know that this is kind of base information that's needed in order for us to quote. I'm going to spend just a few more minutes before I pass it to David and see if there are any additional questions that may have come in. But I'm just going to spend a little bit of time attacking fully insured. And I typically say it's like Stockholm syndrome. They have led you to believe that fully insured is the safest, cleanest, best way to operate an employee benefits plan. It feels so good. You set it and forget it. Well, the biggest myth is that it's other people's money. You're paying a premium and you're like, it's not my risk. I just paid that premium. They're on the hook now. Not so fast. No employer can escape their claims experience. Doesn't matter if they show you what it is or not, you cannot escape your claims experience. That 20% renewal is not because they feel like giving it to you, it's because they are using your claims experience to capture what they think they need and what they think they want. And so there's no escaping your claims information. You can decide not to get it and stay fully insured and stay blind to what's actually happening, or you can consider looking at Centivo, getting your claims information, and creating an environment that allows you to actually save money throughout the year. So here's a scenario, and I usually show this graphic with real numbers, but I'm going to come to you with a proposal that's going to be equal to or less than the renewal, and that's going to be with fixed costs. Now, instead of being the entire premium collected, it's fixed cost that's going to be only on the administration piece. And the variable spend that I'm capping at renewal or below renewal, if you don't use it for claims, if it's not used for the service of your employees and their families, that money goes back to you. 100% of the money that is not used goes back to you. Now, we got a glimpse of that with MLR ruling, and you're supposed to get 15% back. And any money not used is going back to the employer. This is the environment that we're creating, and I'm guaranteeing you savings that it's going to be below renewal. And that's one thing that I want to make sure that you take advantage of. It's not other people's money. You have the opportunity to take control, and fully insured is not the way to go. This is just another way to look at what I just articulated. Essentially, you get 100% surplus return. If you're familiar with, dare I call it, the Cigna level funded product, it's a lot of similarities, but the key is our 100% surplus return. You don't have to use it only towards fees, future fees. If you want to leave, the money is still yours. We are carving out the PBM to Capital RX. Remember, I mentioned that name. You're going to get visibility into your data. You're going to get your RX rebates, something that you have never seen under a fully insured arrangement. All of these things that are differentiation with Centivo's level funded product, you now have access to. Fully packaged, self-funded solution called Centivo level funded. They don't have to think about anything else. Everything is already packaged for them to take, and it feels, looks, smells, tastes like fully insured. I'll just end on this note, and this is, how is it that Centivo is able to deliver 36% savings? And you have increase in primary care utilization, and you have a really rich plan design? Well, I want to articulate to you that we have been able to secure really competitive deals from our provider partners relative to the market. So here's an example in San Diego of a normal childbirth at Sharp Memorial that costs $36,000 to get done. Everyone loves Sharp down here because they've got the stork on top of the building and they run these commercials. Great job, great marketing. But $36,000 versus on a broad network, if you just went to Scripps, it'd be $9,200. Same service, same quality, if not better. But under Centivo, we went a bit further. Same service at Scripps Mercy, it's going to be $7,250. So now, if someone's going to Sharp, $36,000, that's going towards claims, whether it's fully insured, self-funded, doesn't matter. That's a claim that's going and getting paid for, versus $7,250 on the Centivo plan. These are real savings, massive savings that allow us to deliver on our financial projections and helping employers and employees save money. This is what's happening behind the scenes. Couple that with the ability to get members engaged with their primary care physician, we have created a sustainable model that competes with all traditional vendors today, even Kaiser. I know there was a question about Kaiser and if we can operate alongside of them. Absolutely. Every single employer, small group, and middle market employer I've sold has either left Kaiser in place, or they've replaced them, but they've largely left Kaiser in place, and that's okay with us. Okay. I'm going to invite David to give you a view of our mobile experience. But before we transition, I just want to pause and see if there were any questions that might be worth talking about before we get into it. Any questions, David, from the group or?
Everything's been super easy to answer so far, but definitely
Boom.
encourage anyone to keep putting in those Q&A questions.
Listen, the goal today is you should feel empowered. You have another option to put into your toolkit. You can be a differentiator against all of your competitors in the marketplace. You may not have heard of Centivo. Well, guess what? Your competitor may not have heard of Centivo, and you can now use us as a wedge to get that new business or secure your existing business. And so think of us as that option to ride along with you to glory and success.
We did receive, thank you, Harry, for sending in this question. Inland Empire, question mark.
Dang, good question. So, full transparency, we are not yet in the IE Inland Empire. I'm working on it. I'm working on it. I'm working on it. I'm working on it. We know that that market needs us, and so we're working on building that affordable plan there. What we've been doing in the meantime is we've had our Centivo partnership plan to the extent that those folks commute into LA and they want to enroll, we leave that up to the employer to offer it to them or not. Um, Second to that, we've been using the Cigna Local Plus as just a second plan option. So say, hey, you know what? It may not be as affordable as Centivo partnership plan, but it's more affordable than a broad PPO. Let's offer this to this group. It's what we've typically done as well for Northern California. If there's not access up there, which we don't have access, so we use Local Plus when we can to give them that other non-PPO network. But great question.
And just to add on top of that, through Centivo, doesn't matter if you're on the Centivo proprietary plan or on one of our Cigna plans, you would still have great access to our native advanced primary care solution, which is offered completely virtually, but it's just like going and seeing your brick and mortar PCP.
Boom, drop the mic. All right, David, it's all you. I'll stop sharing.
All right, I'll quickly share, and then I see there are a couple more questions trickling in, so I'll make this crisp. We're going to go through the member experience. Let me know when this pops up for you.
Looking good.
Perfect. All right, so you guys have heard Kabuchi's beautiful segment on how we're trying to add value, right? With Centivo, with our proprietary network and connecting your members to their primary care physicians. But we also, of course, want to stress that we are heavily prioritizing member education as a whole, right? How do we actually drive change in behavior and better the underlying claims mix? So hopefully this will show you how we do it. So this is again assuming that at point of open enrollment, your member chooses to elect the Centivo proprietary plan. And at the very beginning, we're already emphasizing, what we call activation with the partnership plan, which for anybody who's familiar with HMOs is really just grounding your members to select a PCP. At the end of the day, our proprietary plan does require referrals for specialist visits, and we'll get into that in just a moment on how you can very easily request referral and get in touch with your PCP team. Referrals are not required to go see behavioral health providers, OBGYN, and of course, urgent care, emergency room care. All right, so you'll notice that Friend Center on the app, as soon as you enter for the first time, you're driven to elect and designate a PCP for you and your family. Now, at the beginning of open enrollment, we'll actually set up a live Centivo provider search website that's unique to your population. On that website, your members can go and see, is their current PCP, let's say on a Blues HMO, a part of the Centivo network? So they can do some due diligence on the front end. But of course, if they choose not to, they can, of course, use our provider search tool that's native on the app. In this case, we're going to look at some family doctors. We have virtual care options. We can look at PCP practices or specific PCPs. In this case, you get some high-level information, how to contact them, what their specialties are, links to their websites if applicable, as well as language indicators for English, Spanish, and any other applicable languages. And that's as simple as that for Serena. So she can go ahead and elect PCPs for her adult dependents, select pediatricians for her children and under 18 dependents, and that's it. She's finished activation. At the very end, we'll call attention to go ahead and contact your PCP office, schedule that first visit, and get rolling on the plan. Now, at any point in time, you could click on your PCP designation and change your primary care team. So the beautiful part of a tech-enabled platform is that Centivo also has behind the scenes a provider platform for all of our providers that are on our network. What this means is that, you know, normally with an HMO where some of the roster updates right after you select a PCP and when your PCP is making referrals to other specialists within that hospital ecosystem, that might take weeks. They might be using a fax system still. The beautiful part of our platform is that it happens within 24 hours, and you're able to basically change your PCP with a snap of your finger. Now I'm going to quickly go over some other capabilities within the app before I turn it back to Kabuchi to answer some of the more Q&A. I see them trickling in. So on your inbox, you'll be able to track asynchronous messaging that you can start with the Centivo member care team. Again, we have our native member care. You're never going to Cigna. You're contacting us as your front line. You'll be able to see new EOBs as they process, as well as track your referrals. Now, earlier, Kabuchi flashed up a referral screen. This is just to refresh your memory on what referrals you have in place. And if you have any inactive ones, you can call your PCP. And again, all PCP care is free, and they can do this over the phone with you, or you could schedule a visit to get checked up before they process a referral. Again, you can contact us by calling into a number or starting an asynchronous chat with our member care. On the Health Hub, if your client or your prospect has any existing solutions in place, we can easily plug and play and do soft links out to those solutions. ID cards, fully visible within the app. Provider search tool. Again, you can look up hospitals, specialists, etc. Activity tracker. So for Centivo partnership plans, while a deductible does not apply, you're able to look at you and your family's progress towards your out-of-pocket maximum, as well as any processed and processing claims and associated EOBs. Finally, more ID coverage, but you can also look at your drug coverage and change your app preferences. All right. Hopefully that was a good enough glimpse. And if you have any questions related to the member experience, feel free to also put those in the chat. But I'm going to pass it back to Kabuchi. We're going to start sifting through some of these questions.
That was a sneak peek into our mobile experience, our member experience, which is a very important part of how we deliver our solution. So a few really good questions that came in. Someone asked about the reinsurer. So very technical. Centivo is not an insurance company, and so we have to work with stop loss vendors. This is behind the scenes work that we do. Remember, we try to make it easy and package this. But behind the scenes, we work with several different stop loss vendors: Roundstone, Skyward, Iowa Re, Berkeley, so on and so forth, to get the most competitive arrangement that we offer to you and your client. We do have some special arrangements, captive relationships with Berkeley and Roundstone that allow us to add extra protection by pooling Centivo only clients in ways that give you that extra protection from fluctuations up and down year over year. I see someone asked about Centivo's financial strength. They must have just saw the news. We got 75 mil from various resources, both equity and debt raise. Morgan Health was a big portion of that. We also had Memorial Care locally, I'm proud to say, is now an investor in Centivo. We're not going anywhere anytime soon. So we're looking forward to growing our business, and I think we're well positioned to be around a long time. Are all primary care services virtual? Not all, but you do have it as an option. And so there's kind of two things to remember. We still have the brick and mortar relationship, right? So UCLA absolutely has virtual care, right, through their own services. That has nothing to do with Centivo. And then Centivo is supplementing what you would typically get from your local healthcare provider in terms of virtual access by providing that primary care virtual team, that Centivo primary care team. So not necessarily only on primary care, but you can also do it with specialists in person or virtual. Nothing for seniors. I do see someone who asked about senior coverage. Nothing for seniors relative to what we've built. So, you know, obviously they can still enroll and have it as an option, but nothing in particular for seniors. And is the app and website available in Spanish? I might have to ask David to help me to confirm. I do know that the app is not available in Spanish today. It is being worked on. And then, of course, we have our member care team, customer service, who can respond and support our Spanish-speaking population. As you can imagine, we have a large portion of them. David, any thoughts or comments on website or app?
Correct. So we are able to help translate open enrollment materials and marketing materials into Spanish. At this time, the app is not yet available in Spanish, but you can steer your member to call into our member care team, where we do have Spanish availability, as well as live translation services for non-Spanish, non-English languages.
I love it. I love it. Any other questions I may have missed, David? I might be there.
I think there's a couple that we need to send follow-ups on, but I think you nailed most of them.
Boom. Well, listen, I cannot thank you enough for taking the initiative to be a part of this discussion. It starts with education, and it starts with you deciding how you want to operate on behalf of your client. And so my appeal to you, my ask of you, is to extend some level of trust that Centivo is going to either tell you immediately that we are not a good fit, or if we are a good fit, give us a shot to show you and flex our muscle on what affordability should look like for your client and their families. I will stick around just for a couple of extra minutes, maybe put on the music again so that folks can hear it on their way out. But thank you, thank you, thank you. I hope you learned something new, and I hope you're excited to work with us through Word & Brown, so we can get this relationship to be the envy of every other general agent in the country. Thank you, guys. Oh, I do see a couple of questions came in, so I'll answer those as well. Centivo is only the fiduciary to the extent of we are processing or taking action that the employer has hired us to do. So we are not explicitly the fiduciary. Those responsibilities remain with the employer. So they have the ultimate decision of approving or denying, but we will work on their behalf, right? Through the contract that we have with them, they ask us to do certain activities that ultimately are kind of making us the fiduciary, but they are still listed as the fiduciary, if that makes any sense. No timeline on Northern California yet. You know, this stuff is hard. We got to get partnered with with a health system that really believes in what we're doing, and the Northern California market is not yet there. So we're continuing to have conversations, but you know, we'll only do it if we can deliver on the financial value prop that we have consistently across the country today. EDI API feeds available for enrollment. Absolutely. We work with any BenAdmin platform, so there can be communication back and forth. We have an enrollment template. We don't do paper enrollment forms, so we have an enrollment template that can be used. You can just fill in this Excel spreadsheet of all of the information, and we'll get it going once we're implemented. I see a question about how do we track providers who are accepting new patients. And it's a tough business, but that's why we do what we do. We do get that information directly from the hospital system, so that is updated and provided to us on who's actually accepting new patients. But good question. All right. I know we are right at the top of the hour. Thank you,
Kabuchi David, I
guys.
want to thank you both on behalf of Ward and Brown General Agency. I believe that we will be providing a question and answer follow-up pertaining to questions that were addressed and additional questions that were not. Thank you for our continued partnership and appreciate our time together. Thank you.
Thank you.
Thank you.